All right, today we'll finish up our introduction to the lab. All right, continuing on. So you'll use a bunch of little electronic software. If you're familiar with, electronic items and software. So of course this is for glucose, so very common diabetic testing supply. Photometer, what's photo?
Light.
Light, so it's measure light intensity. A lot of times they'll use this for sugar, how much sugar is in a solution, because light bends in a solution, and depending on how much it bends will determine how much sugar's in the solution. So really easy way, just get a little drop and then they'll shine a laser through. Depending on how much it bends, they can determine the sugar concentration. Precise measurement is important, so you'll use pipettes and sometimes even micro pipettes that can go down to 1 microliter, right? That is what? Thousandth of a liter? No, 1/1 millionth of a liter. That's small. So those are the micro pipettes. You should be able to take or dispense 1 microliter worth of fluid. That's crazy. That's crazy accurate.
That's like the equivalent of like one droplet, right?
Yeah, it's even smaller than a drop. It's tiny. We're measuring blood cell, so meter, and then here we're just measuring heat. So just simple thermometers and even the forehead scanning ones you'll use. All right, let's go. So these are the parts of the microscope. So focus controls, light intensity. No, they're going this way. They're going this way first. So platform for the slide is, of course, the stage. Contains magnifying lens. Well, two things does, right? So that magnifies and that magnifies. Oh, okay. So here, one is oil. So now this eliminates. So that means contains magnifying lens is the ocular, and then one of the three, low, medium, high, would be the objectives. Right? So we did that. Condense the light. So similar to the aperture. That's gonna be the substage. All right. Moves the body tube up and down. That's the focus control. And then lastly, calibrated to count cells. So last time I mentioned a automatic scanning microscope. So here's an automatic counting microscope. Standard precaution. Are you familiar with universal precautions and standard precautions?
Universals treat everyone as if they were infected.
Yeah, so it used to be universal. So now it's standard. So that means we need to protect everybody. So the healthcare worker, the patient, the trash man, anybody who visits your facility, we must protect them from infection. So universal precaution was just basically about the healthcare worker, but now it's everybody. We need to protect everybody. So of course your PPEs, personal protective equipment. So depending on the infection level, will determine your PPEs. So what do you need for droplet precaution? What's the minimum?
Goggles.
So for droplets, it's 3 feet. So if you're going to be within 3 feet of the sample or the patient, then wear your PPEs. What if it's particulate precaution? What do you need? You need a HEPA mask. So droplets, they're only going to fly about 3 feet. But particulates, they're going to stay in the air suspended for a long time. So you'll still breathe them in across the hall, even across the room. Of course, wash your hands in between patients. Take them off before you leave the room. Avoid sharp injuries. One thing we don't do is recap needles. Spills and splash. Number one thing is containment. So don't let it spread, especially if it's toxic or biohazard. We do have fluorescent powder. So we can mix that powder with a solution, make a spill on the ground, and then we have you guys clean it up. And after we're done, we shine a black light over the area, over the personnel, to see if they're able to contain the infectious agent and not contaminate themselves. So we can do that exercise. We have spill kits for that as well. Dispose of waste correctly. We mentioned this a little bit last time. So we have sharp, we have biohazard, we have chemical, we have drug, there's nuclear waste. So if you're dealing with like radioisotopes, so those have to be eliminated a different way. You have anti-neoplastic agents, so that's your chemo drugs. So a lot of different waste streams in the lab, so just put them in the appropriate one. It's not that I don't trust you, it's just that I don't trust anybody. So same thing with specimens. Just treat them as if they're contaminated. And even the outside of the container, I'd even wear gloves if I'm handling the outside of the container. Accidents, always report. If you don't report and get the appropriate medical attention, you may not get paid your workers' comp. So usually it's like 24-hour, you gotta report it or at least get seen by somebody from that your workplace recommend. Otherwise, it's not gonna be on the job injury anymore. They'll consider it something else. Housekeeping. One thing we want to rotate is the pH of our cleaning solutions. So certain things will survive at low pH, that's acid conditions. So next month we'll switch it up to something that's basic. So now we'll kill everything that's acidic. And then the month after that we might switch back to our acid. That way we don't allow anything to grab a hold in our lab. This is the same in hospitals. Most of the superbugs are the ones in the hospital because that's where all the antibiotics are used. So all the strong ones are at the hospitals. Nowadays, for just regular cleaning, household cleaning, you don't want to use anything that's antimicrobial. So what's happening is we are killing all of the good bacteria on our body as well. All right, clean up spills, clean up equipment, of course, and then dispose appropriately. Guidelines for safety, we'll just list them off. So your PPEs, removing and washing your hands, sharps, we don't recap. Only use the equipment that's recommended, and then there's the cleaning and disposal. QA. So remember, QA is everything you do before the actual lab. So this includes training, equipment calibration, maintenance, all your facility needs, everything to ensure that the lab is done correctly. Safety, and then we'll talk about the different difficulty levels of the lab. All right, Clinical Laboratory Improvement Amendment. So a couple updates. But the main thing is it covers all labs. So if your doctor has a lab, it's covered. If your hospital has a lab, it's covered. If a clinic has a lab, it's covered. Waivers. You must demonstrate your ability to perform medium complexity and high complexity tasks. So you'll get a certificate of waiver saying that, yeah, you prove that your office, your physician office, is able to do these tests, these lab tests. So most of the time it's moderate in the office. For high complexity, you might do maybe one or two in the physician's office, but most of these will be sent out to the reference lab. QC. So QC is during and after. So we might monitor your staff while they're doing the lab, right? That's one thing for your control. And then after the lab is done, we may even send out our results to an outside lab just to confirm your results. So that's part of quality control. It's done afterwards to ensure quality. Instrument and equipment. Some items you need to calibrate before use. So every time you use it, you got to calibrate it. If you forget to calibrate it, all those measurements may be off. Training, education, just like in class, we can give you videos, handouts, things to read, but we'll do evals, hands-on evals, and exams to verify competency. Standards. So a standard usually are solution standards that we'll use to calibrate our equipment. So for example, if you need to calculate dextrose percentage, your standard solution is just water. Because regular water bends light a certain way, so we know how much it's bent. And then the machine will record that and compare the rest of the angles based on your standard, which is just water. Control samples. So for today's plates, so we got agar plates. So this is growth media for bacteria, fungus, so mostly the microbes that will try to grow. So for our agar plates, we need a positive control and a negative control. So anytime you run test samples using media, you have to run these two with it. So a positive control is to make sure that things can grow. So we get this from the manufacturer. We got to make sure that, yeah, there's food on it and bacteria and stuff can grow. So we're going to inoculate it with some known microbes, and we expect it to grow. For the negative control, we're just going to take it out of the packaging, tape it up, and we're just going to label it as the negative control. Do we expect anything to grow on this plate? No, right? So nothing should grow, but if something grows on this plate, we cannot trust anything from that stock, because how do I know if the rest are contaminated? Right? Same with the positive control. If nothing grows on your positive control, then you're going to have to question the test media. Is it able to support life? So we'll run the two positives and negatives, and then you'll do your sampling today. Qualitative versus quantitative. So qualitative is what it looks like. So remember the CFUs, we can determine if they consume blood or not, just based on the agar color. So that's a qualitative test. The color itself of the colony will determine its characteristics, or what it looks like, its morphology under the microscope. Right, those are quality. Now we can count how much bacteria is in a solution if we use a quantitative test. So on your agar plate, you'll do your smear, and then a bunch of colonies will grow. And then you'll need to count every single one. But what we do is we just estimate. Got a grid here. Get one that's fairly representative, count how many is in that one, and then just multiply by how many boxes. That's just a rough estimate. So quantitative deals with the number. Reagents. So these are your chemicals. So they expire as well, especially your standards. So your standards are good for like a year after you open them. Your other chemicals, same thing, a year or two, and then you got to throw them out. They might change or lose their effectiveness. Yeah, maintain equipment. So at minimum, your equipment's probably going to need to be calibrated at least once a year. So you can get them to come into your facility, or you must send your equipment out. Either way, make sure you have a backup while it's going through calibration. In medicine, if it isn't written down, it never happened, right? So some things you'll need to reference all the time. You cannot perform a lab unless you showed competency to do so. So one way is just through the testing. Employers, okay, so this is just in general about a lab employer. So of course, yeah, they'll let you learn new labs. That way you can perform. It's always advantageous for them to do so. You can always look up information. Let's say it's a brand new lab that's new to your facility. Then just reference the material to learn how to do it. Outside lab. So sending samples, we can send them multiple ways. We can mail them. We can use a courier, like a FedEx, or we can use your private one, a private courier. They might pick up throughout the day. They may pick up at the end of the day. Just make sure all your samples are labeled correctly. You don't violate HIPAA, and they're actually put out for the courier to pick up. Purpose of QA, quality assurance. So does that happen before or after the lab?
Before.
Before. So quality assurance is before. All right, let's do some testing. So of course, instruct the patient. And then ID the patient as always. Collect the specimen. And then if you need to, you might have to fix it and send it out. Mr. Jones called for his lab results, but the physician has not reviewed the results yet. What should the medical assistant do?
So Dr. Jones said, I mean, not Dr. Jones, Mr. Jones said, they'll get back to him exactly the result.
Yeah. So just tell Dr. Jones, hey, the doctor will get back to you with that information as soon as he can. So let's see what they say. Tell the physician will review results before releasing to them, and that the physician will follow. Oh, so we got it. One important thing before you file away any lab results, make sure that you see the doctor's initials on it to show that they've reviewed it. So if you put it away without them looking at it, then that might cause a medical error. So the initials are present. Record keeping, no problem. Just know what system you're using. Middle digit, first digit, or last digit system. Specimen, of course. ID them appropriately, but de-identify the patient because of HIPAA. When she receives Mr. Jones' laboratory, I guess this is the doctor received Mr. Jones' laboratory results. She notes that his glucose is elevated. What should the medical assistant do?
Tell Mr. Jones that Dr. will inform of the results.
So for the MA, so whatever you use to flag it, so here they circle it for this facility, but that's so for the doctor to see real quickly. All right, that brings us to the end. Quality is not an act, it is a habit. Aristotle. All right, let's do some plating. So you'll do a positive and negative control first, and then we'll get some swabs and we'll sample different areas of the lab and campus.